My name is Naomi Clarke. I'd like to thank you all today for joining together in listening and actively helping to improve the system that we all consume. Now I'm 41. I have stage 2 or type 2 respiratory failure with CO2 retention, which can also be considered as COPD, and it sucks. Okay, so that is the setting for today, that we will be talking about COPD and in particular conditions that relate to it. Now, first of all, a little bit about myself. I'm wearing a Zach hat and love heart glasses because at times we need to deal with difficult situations but always show love. Now, as a consumer, which I am, because I am someone's daughter, I am a wife, I am a sister, and I am me being Naomi Clarke. Now, what I would like to say today is that being in a motorised wheelchair and diagnosed as a CO2 retainer I have T2 spinal cord injury as a result of surgery. I've been in my motorised wheelchair for approximately 10 years. However, my injury occurred just before the age of 5 years. Now, I'm only new to the system as a CO2 retainer, for which a 12-month diagnosis, which was somewhat difficult to come to. Now, I went to approximately 4 hospitals and numerous doctor's appointments before a formal diagnosis took place. Now, during that period, I had advised that I had difficulty in breathing. I had a cough, which just didn't seem to go. I had sudden sleep episodes to the point that I was falling asleep on the toilet, in the shower, on the train, and whilst on the phone in mid-sentence, and even walking home in my wheelchair, to the point where I even crashed into a car. So I ended up going to a hospital and being set up with a VPAP machine, which I was advised would be my salvation. So I tried to breathe through the VPAP machine. However, I was unsuccessful, despite people telling me even old people could breathe through the machine, and I couldn't. So it caused an added stress because I felt like I was failing, despite my drive of wanting to live. Now, as it worked out, the reason why I couldn't breathe through the machine is that it didn't actually have any oxygen being filtered through, nor was the machine actually calibrated for my lungs. So today it is calibrated, and today I can say successfully that I use the machine to breathe at night. Now, despite me being able to use the VPAP, I do have somewhat considerable difficulties during the day, and one of these difficulties is the fact that I am trying to stay out of a nursing home because I require somewhat around-the-clock observation and somewhat assistance, especially because I have sudden sleep. Now, being in a wheelchair, I require a portable bottle during the day because I require oxygen. Now, if I was to use a concentrator with a 30-meter cable, which I have been advised is within reason to do so, I become entangled with the tubing and therefore require extra help. Now, my husband and I choose to pay for this privilege of being able to breathe independently at the cost of approximately $400 a month. The hospital do provide approximately 4 bottles, and then just have recently uplifted that to 8 bottles a month. There is still a gap which we find difficult to meet. We also have support of 4 nights a week, which is funded assistance. However, there are 7 nights in the week, so it doesn't make sense that we only have a need for 4 nights out of the 7. So the need just doesn't go away, so we privately fund, with great difficulty, the extra 3 nights that is required to maintain my breathing safely. Now, the quality of care that we have received has been at times completely difficult, because I've had people turn up to work in their pajamas to shower me. I've had people leave the home without putting my oxygen on. I've had people advise of my medical condition on Facebook whilst I've been asleep. I've had people quit at 3 o'clock in the morning. I've had people leave for cigarette breaks and then come back into the room where I can't breathe because of these cigarettes. And it appears that whenever you do provide feedback, that the services are cut because there are not enough staff to fund active shifts. It appears that when you do complain, that because there aren't enough staff, they'd have to do something pretty drastic, because it's about filling the shift rather than being concerned about the quality of care. Now, with science today, it's great that people can live longer. However, we do need to provide a quality of care and ensure that the system is funded correctly, those that are needing it, because if people can work together, like the Department of Disability and the Department of Health, for example, in conjunction with other organisations such as palliative care, for example, even the council, it means that people can be provided with a holistic approach, and the silos of money can be fairly calculated without causing people financial distress, and that is including the departments that are funding it. Now, if we can remove all those hard obstacles, like my hat, and we remove the glasses, and now I can see. But not only that, it reminds people that it's about people rather than the costume of being a dress rehearsal, because this isn't a dress rehearsal. This is about someone's life, and the fact that we all need to work together as consumers and to share the load without being in crisis. Now, our family was in crisis prior to us receiving help. My mum wanted to kill me, not because she hated me, but she felt that it was her only option to relieve us of the pain. So then she wanted to kill herself in an attempt to get us help, because she felt that if she wasn't here, that the system would help us more, because she felt that by her presence that our hours would be reduced. Now, in fact, my mum is getting tired, and so is my husband, So, to keep our family unit together, we as individuals come to those departments seeking help. So at our stage in life, it shouldn't be a worry or a concern on who's caring for us tonight, despite the fears of death. We should just be able to enjoy the time that we have and not worry about the obstacles in the way. So this may seem like a bit of a muddle, but I'm telling it how it is, that I hope from today that we could maybe workshop it and improve the system and work together as consumers and professionals and resolve some of these short-term and long-term problems and improve the quality of care and challenge the science and longevity and meet them hand in hand. So I thank you again for your time, and let's remove the suck from COPD. Thank you.